Neglected tropical diseases, also known as NTDs, are a diverse group of communicable diseases that are present in 149 countries around the world. They affect over 1 billion people across the world. 7 of the most common NTDs can be found in a number of low and middle income countries within Africa, Asia, and Latin America. NTDs target populations living in poverty and those that are in close contact with infectious vectors and domestic animals and livestock. These people tend to have little access to clean water and proper ways of disposing human waste. Women and children are the most at risk in these regions. Lymphatic filariasis, or elephantiasis, causes severe swelling of the extremities or the genitals. Trachoma is a bacterial eye infection that causes visual impairments and blindness. Onchocerciasis, or river blindness, is transmitted through the bites of flies and is a parasitic worm disease. Schistosomiasis, or snail fever, is transmitted by a snail host but caused by a parasitic worm. Hookworm, whipworm, and roundworm are all soil-transmitted helminths.
Hi, I'm Dr. Brittany Smith here at the Sabine Vaccine Institute, where we're going to talk about the work we do here. So first off, we're a nonprofit organization made up of scientists, researchers, and advocates. Every day, we work towards controlling, treating, and eliminating vaccine-preventable diseases by creating new vaccines, encouraging the use of existing vaccines, and promoting increased access for affordable medical treatments for the nation. We partner up with the government, academic institutions, medical professionals, and non-profit organizations like the Bill and Melinda Gates Foundation. Through our research, we have discovered that 5 of these neglected tropical diseases can be controlled by what is known as the Mass Drug Administration. The 5 include lymphatic filariasis, onchocerciasis, schistosomiasis, trachoma, and soil-transmitted helminths. Essentially, we have discovered that these 5 can be treated with pharmaceutical drugs. This is a huge win for humanity, although there is always more that can be done, which is why we have 3 leading programs to raise awareness about the topic. The 3 programs are the Sabine Vaccine Development, the Vaccine Advocacy and Education, and the Global Network for Neglected Tropical Diseases.
The Global Network for Neglected Tropical Diseases is an initiative of the Sabine Vaccine Institute. It works to raise awareness, political wills, and funds to combat NTDs.
Hi, I'm a representative for the Global Network for Neglected Tropical Diseases. I'm here to discuss our efforts at achieving an NTD-free world. We are dedicated to eradicating the world of NTDs so that every single person on Earth is able to grow, learn, and become productive members of their communities. Our organization works with the highest levels of governments, businesses, and members of the society to lower financial barriers for treatment and collaborate with other groups and partners to help get the necessary resources to these people in need. These platforms focus on clean water, sanitation, hygiene, maternal, newborn, and child health, and low cost for nutritious foods. We attempt to do this by mirroring the goals of the London Declaration. To further discuss the London Declaration, we're going to be speaking with one of our international associates via Skype.
So the London Declaration was inspired by the World Health Organization's 2020 roadmap on NTDs to control and eliminate at least 10 NTDs by the end of this decade. We set out to sustain, expand, and extend programs that ensure the necessary supply of drugs and other interventions to help eradicate guinea worm disease and help eliminate the NTDs mentioned earlier. We enhance collaboration, coordination on NTDs at national and international levels through public and private multilateral organizations, such as the Global Network. We enable funding with endemic countries to implement these programs and provide technical support tools and resources to evaluate and monitor programs. In addition, we provide regular updates on the progress in reaching the 2020 goals and identify remaining gaps.
The N7 is a campaign created by the Global Network for NTDs and Sabine Institute to collect money from donations and fundraisers to see the end of 7 diseases by 2020. 100% of donations go directly to the N7's treatment programs. The deadly 7 diseases include It only takes 50 cents a year.
It only takes 50 cents a year.
A 50-cent donation can protect a child from these 7 neglected tropical diseases a year.
Now we will look at the impact these organizations, combined with the efforts of others, have had on neglected tropical diseases so far. In 2016, Guatemala was reported to be free of onchocerciasis after employing elimination strategies for decades. They were the 4th country in the world to be verified onchocerciasis free after Colombia in 2013, Ecuador in 2014, and Mexico in 2015. Now let's look at trachoma. With the SAFE strategy, which stands for surgery, antibiotic treatment, facial cleanliness, and environmental improvement, the number of individuals affected by trachoma has declined from 317 million in 2010 to 200 million in 2016. In 2015, 185,000 individuals were able to receive surgical operations for the late blinding stage of the disease, and 56 million were able to be given antibiotic treatment. Thanks to collaborative efforts between the Sabin Vaccine Institute and the Global Network for Neglected Tropical Diseases, 1.1 billion treatments were delivered in 2014, and 2.4 billion tablets were donated by pharmaceutical companies in 2015. As you can see, no one country, government, or organization can do this alone. Let's rise together as one nation and beat these awful diseases.